This trial has been going on for about 2 years, and it's open to patients with all indolent non-Hodgkin's lymphoma, including follicular lymphoma, marginal zone lymphoma, and mantle cell lymphoma. Everybody in the trial gets 12 cycles of induction therapy, which consists of lenalidomide, 20 milligrams daily, days 1 through 21 of each cycle, as well as some rituximab. And then after that 12-cycle period, which is approximately a year, patients with stable disease or better are randomized to receive either maintenance therapy with the combination, which we call R squared, or to receive Rituxan monotherapy, which would be considered a standard of care. The data that I'm presenting today have to do with subsets of the follicular lymphoma cohort. So at the data cutoff, there were about 160 patients with follicular lymphoma enrolled. About 50 of them are what we call early relapsers. These are patients that had a recurrence of the disease within 2 years after initial diagnosis. And those patients are known to have a worse prognosis. Their 5-year overall survival is only 50% compared to 90% of patients, over 90% overall survival, 5-year overall survival, who did not have that early relapse. Another subset of high-risk patients are what we call double refractory. These are patients that are refractory to both an alkylator and to rituximab. And that was another 50 or so patients in the study. So we wanted to look at was to see how effective was this R-squared regimen, the Revlimid and rituximab, for those patients. This is an early report from the study. The median follow-up was only about 10 months, so most of the patients in the cohort haven't yet reached that randomization phase where they're randomized to the maintenance option. So the study is really looking at what's the best response they got to the induction therapy. What we found was that for the follicular lymphoma patients as a whole, 66% had the overall response rate was 66%. In the early relapsers and the double refractory patients, it was on the order of 45%, so not quite as good, but still pretty good for that high-risk population.